A dark time for American healthcare, the threat to the Affordable Care Act. A looming crisis, the assault on healthcare. The landscape of American healthcare has undergone a dramatic transformation since the inception of the Affordable Care Act, ACA, resulting in a historic low of 7.7% uninsured citizens, a significant drop from the 16% reported in 2010. The ACA, colloquially known as Obamacare, has been instrumental in providing coverage to approximately 45 million Americans. This includes 24 million individuals who have enrolled in the health insurance marketplace, while the remaining have benefited from Medicaid expansion, designed to assist those previously ineligible. The ACA's financial incentives encourage states to broaden their Medicaid programs by offering a federal match that covers 90% of the expansion costs. Of the 45 million covered, nearly 21 million received ACA coverage in 2024, thanks to new provisions that include enhanced premium subsidies for individuals below 400% of the federal poverty level. This assistance is crucial for low-income individuals seeking health insurance, promoting a healthier society that benefits everyone, including businesses and industries, and eliminating the burden of cost shifting from the uninsured to the insured. However, the future of healthcare is now clouded by uncertainty due to the Trump administration and Congress's actions. The passage of the Budget Reconciliation Act, dubbed the Big, Beautiful Bill, introduces sweeping changes to the ACA and Medicaid, potentially leaving 12 million Americans without coverage, according to the Congressional Budget Office. In 2017, President Trump and several Republican lawmakers failed to dismantle the ACA. However, they now have the opportunity to undermine numerous ACA provisions, a move that appears to be a top priority. The legislation proposes significant cuts to ACA/Medicaid funding, with the enhanced marketplace premium subsidy set to expire at the end of 2025 without renewal. New patient copayments will be introduced for those under expanded Medicaid, and there will be reductions in the permitted Medicaid provider taxes, which help cover states' share of the Medicaid expansion to leverage the enhanced federal match. The focus on Medicaid work requirements and intensified eligibility scrutiny has already led to a 90% reduction in ACA enrollment outreach by the administration, and Congress has shortened enrollment periods. Limitations on Medicare eligibility, marketplace premium subsidies for specific legal status immigrants, and federal funding for emergency care for undocumented individuals are also on the horizon. Massive cuts to Medicaid funding for long-term care will result in eligibility restrictions, service reductions, and potential nursing home closures. The Senate's proposal includes hikes in certain marketplace plan premiums and denies Medicaid coverage to many legally residing non-citizens, including refugees and immigrants with unverifiable statuses. Additionally, the bill suggests decreasing the enhanced 90% federal match for states that cover undocumented immigrants under expanded Medicaid. However, the parliamentarian deemed these provisions ineligible for inclusion unless the Senate opted for a simple majority vote instead of the standard 60-vote requirement, cloture. There is speculation that these provisions may be revisited in the future, accompanied by additional proposals such as alternative lower premium insurance plans that lack the ACA's consumer protections, like coverage for pre-existing conditions, plans with high risk, high premium insurance pools, curtailing the enhanced expanded Medicaid match, converting Medicaid financing to state block grants, and imposing an overall cap on federal funding. On a positive note, Trump supports measures to protect against surprise billing, enforce hospital price transparency, and reduce drug pricing. The need for substantial reductions in federal spending to extend the 2017 tax cuts and introduce new ones has led to the targeting of the ACA and Medicaid, as Trump has vowed to leave Medicare, Social Security, and defense untouched. These developments signal a troubling time for American healthcare.